Arthritis, the aging joint phenomenon. Everyone thinks they're destined to have arthritis because their parents had it or because they've played too hard over the years, whether in sports or their career. Well, today we're going to take what you think you know about arthritis, we're going to spin it on its head and give you a whole new groundbreaking perspective on what actually triggers the onset of osteoarthritis. This is Behind the Scenes with Elite Concepts Physical Therapy and Performance. I'm Dr. Leslie. Knee joint arthritis, specifically osteoarthritis, is the deterioration of cartilage within the joint, resulting in pain, swelling, and loss of function. Interestingly, knee osteoarthritis is one of the leading causes of disability in the United States and one of the primary ailments that adults will deal with in their lifetime. So for years it's been suspected and assumed that it's simply a mechanical breakdown of the cartilage tissue that causes pain and inflammation associated with osteoarthritis. Think wear and tear and overuse and extra pounding from hard work or sports. However, there's growing research supporting a new concept that osteoarthritis can be linked to a traumatic knee injury years earlier. Now, that also might seem obvious. It was assumed that it was due to a change in the mechanics and load that escalated the wearing down of the cartilage. But check this out. It's not just about the mechanical force. It's a physiological response to exposure to blood. So with certain knee injuries, such as a ligament sprain like an ACL tear or a meniscus tear, bleeding and swelling can occur within the joint itself. We call this hemarthrosis, often referred to as joint effusion. It turns out, bleeding within the joint from the traumatic injury triggers an inflammatory process of the synovial lining of the joint, called synovitis. Synovitis can become a chronic situation resulting in a slow, progressive deterioration of tissue within the knee joint, including the cartilage. So what they've discovered is that there's a component in blood that's now thought to trigger the cascade of events that causes inflammation, which again leads to slow breakdown of the cartilage. So rather than it being an injury that causes a change in mechanics that leads to arthritis, it's actually a molecular trigger from bleeding within the joint that leads to synovitis that can lead to osteoarthritis. Now, this is not to say that mechanics are not contributing, but there's more to it than was previously understood. We know that people who sustain an ACL tear, whether or not they have surgery to repair it, have a significantly higher risk of developing early osteoarthritis in that knee. And within just 2 to 5 years after ACL injury, there's already signs of osteoarthritis setting in. Now we know that it's not just about the altered mechanics of the joint, but it's also a direct result of the injury itself. So again, researchers have now linked blood exposure to synovitis to the development of future osteoarthritis. So osteoarthritis is no longer just a mechanical wear and tear situation as been previously thought. So the real take-home message is that if you're an active individual and you want to stay active as you age, it's essential that you minimize the risk of even small injuries to your joints so your knees can keep up with your lifestyle and you can do all the things you want to do no matter what your age is. And if you've been through a traumatic injury and you suspect your joint is suffering as a result, then it's imperative that you continue to exercise smart to keep the surrounding muscles strong and flexible and the joint mobile so you can stay active and enjoying life for as long as possible. The ACL Strong exercises are all targeted to help you stay strong, healthy, active, and injury-free for all of life's adventures. Thanks for watching. Have a great day.